Hi, everyone. Welcome to Preparing for Clinicals with me, Marlee, and today we are going over 10 tips for success in your clinicals. So I have been with Picmonic for about almost 10 years, and I'm the Master Nursing Scholar with Picmonic. So I help with the content in the nursing market, creating a lot of study guides and different things to help you guys with your exams and nursing school from day one all the way until the NCLEX. So what we are covering today is we're going to go over some basic clinical info, and then we are going to go over tips for success and talk about critical clinicals. And then at the end, we're also going to talk a little bit about Picmonic and TrueLearn and how to use that system to help you succeed in not only clinicals, but also your exams and the NCLEX. So let's get started. So clinical summary, just a little bit of information on clinicals. So traditionally in your nursing programs, depending on your nursing program that you're in, you will have the following ways of learning. So you have the classroom or online lectures for your fundamental knowledge to understand how things work, to get the theoretical knowledge in there. Then you have simulation lab or sim lab for practicing your nursing skills before you actually care for real clients. So this is just where you go into a lab, and then you get to practice on either some fake patients or different skills or with each other. And it's basically so you can get familiar with the different skills that you'll be seeing in actual clinicals. And then you have your nursing clinicals on the floor, which is where you apply your skills and take that knowledge into the real world, because we all know it's very, very different than it is in a simulation lab. So clinical rotations for nursing may include acute care, long-term care, med-surg, OR, pediatrics, labor and delivery, mental health facilities, community settings. There's a ton of different areas that you could be having your clinicals in where you're placed. And then most often you will be at the end of your nursing student, like your last semester, you'll be doing an internship or a preceptorship, whatever it's called in your nursing program, where you are placed in one of these clinical rotations, and you're in there for a longer period of time. And that's where you actually are working as a nurse would be working. You're still in your preceptorship or your internship, but this is where you are acting as though you are actually a nurse without being a nursing student. So things to expect to be performing, things like taking a medical history, head-to-toe assessment, vital signs, bathing or dressing patients, making beds, assisting patients to walk or to toilet, assisting with procedures, administering meds, communicating with patients and their families, communicating with the interdisciplinary team, charting, giving handoff reports. These are a lot of the things that you'll be doing once you're in your clinicals. All right, tips for success. Clinicals are a time where you get to really understand what kind of nursing you like, really practice your skills, bond with your fellow nursing students, and potentially connect with future employers and coworkers. So this is a very, very special time in your nursing student career. It is a very stressful time. It is a very scary time when you don't know what you're getting into. So I understand that a lot of you guys can be stressed going into this. But if you look at it with the perspective of this is a chance to learn all I can about what I'm interested in, who I am as a nurse, people I'm going to be meeting, like it's really, really an amazing time to be growing and expanding on so many different levels. And if you change the perspective within yourself from being stressed and nervous to excited about all the opportunities you're going to get from this, it really, really helps. So it's interesting too, because you may think that you want to go into a field of nursing, and after your clinicals realize, wow, I really don't want to do this, and I'm actually really interested in this. So it's a really cool thing to be exploring all these different options. Okay, let's go into our tips. So tip number one, healthy habits are your foundation. So I know this is kind of obvious, you would think, but it's really, really important that you lay these foundations out, because if you don't have the proper foundations going into your clinicals, you are just going to be completely blindsided the entire time. So it's really important that you focus on maintaining a proper routine, a proper foundation, so that you can go in and be very level-headed. Because again, remember, I'm going to keep repeating this, it's a very stressful time. So the less stressed you can be, the better. The more confident you can be, the better. And the only way to get to those levels is having really good self-care and a good foundation. So sleep is extremely, extremely important here. Don't forget, you're taking care of people. Like, a lot of people are depending on you. So if you're walking in with a lack of sleep, with being foggy and not clear-headed, it is completely your responsibility to make sure that you are able to take care of patients and that you are going to be practicing in a safe environment. So things that can help you here, obviously, like make sure you get to bed on time, eliminate screen time, like do what you need to do to make sure that you can have some good sleep hygiene and go to bed. And then lay out all the items that you'll need the night before, because a lot of, like, especially if you're on day shift, like those shifts start really, really early. And so if you want to maximize your sleep, like what I used to do is just like lay out my scrubs, lay out all the items I'm taking, like literally sleep till like, not the last minute, but like maximize my sleeps and know that like I'm not going to be scrambling trying to get my stuff together by the time I'm leaving. Everything's already laid out. I have all my items I need, and you're more organized that way. So when you're on the floor, water is essential. It's really easy to get dehydrated because you're running around all day, you're not drinking water. It's important to bring water, keep sipping. A lot of times too, you're like looking forward to those coffee breaks. And even if you don't want a coffee, you're just drinking coffee. And remember that coffee is so dehydrating. So please be drinking water. You're also going to be exposed to a lot of new sights and smells and noises and all these different things that are kind of destabilizing to your system. So remember, being properly hydrated, being properly fed. So I'm going into eating balanced meals, tip number, or the little number 3 here, so that you don't have a sugar crash. Also don't get too full so that you're tired or nauseous. I remember like my first couple of days, I was pretty nauseous just because I was waking up really early. My body wasn't used to being up that early. I was like not really eating in the morning because it was too early to be eating for my body at that time. And then I was like feeling really sick because I was just exposed to a lot of different things and my eyes are just like wide the entire time. Like, what is going on? So just make sure you're properly balanced: hydration, nutrition, sleep. Bring snacks if you need to bring snacks. And then a really good tip here is also doing like a 5-minute breathing exercise or meditation before your shift, especially if you're really nervous, especially if you're scared. Just try to calm yourself down and get recentered. And you can do this throughout the day, because those first couple of weeks, they're quite, you can be intimidated and you can be flustered and it can be confusing. And it's important to just be able to be calm and just have a really steady mind so that you can absorb as much information as you possibly can. All right, tip number 2, get prepped with efficiency tools. So always keep a small notebook and pen in your pocket to take quick notes. That's going to be your little notebook. It's going to be like so important, because you're going to be jotting down stuff all day, stuff that you don't know and want to look up later, times, vital signs when you have nothing else to write on and you like won't be able, like, because you won't remember anything. So you really have to write down everything so that you can remember in your charting later, or when you get home and you're like, what was that thing I wanted to look up about that patient that like was a really good learning opportunity, but now I can't remember what it was. Oh, I'll go back to my notebook. If it's possible, if your unit allows it, to have your iPhone or Android apps for references, for any meds or any side effect, anything that you need to like look up a reference there, that can be helpful. Remember that it is impossible to memorize all the information, no matter how much you think you're going to remember while you're on the floor. Like, you're going to be really overwhelmed. There's a lot of new things happening all the time. So the likelihood that you'll remember everything is quite small. So Remember, the pen and paper are really handy here. Use tools to help, like Picmonic's critical clinical cheat sheets, which you'll be seeing throughout this presentation. We sprinkled in some of those cheat sheets that are really, really helpful. And if you can use them on the floor, it'll be quite beneficial. And then continue leveraging Picmonic and TrueLearn. So using Picmonic and TrueLearn are the efficiency tools that will also help you get prepped, going back and looking at those at the end of the day or on your breaks, just opening your app and just going through some of these things will help you keep you on your toes. Here is what I was talking about. One of the things we're sprinkling in from one of our cheat sheets that we're sprinkling in from the critical clinical cheat sheets. So you'll see here, this is the head to toe assessment, and we go through all of the areas that you'll be doing a head to toe assessment, and just like a quick little cheat sheet on if you forget a certain part of the head to toe assessment, we got it here for you. So you can print this out and keep it with you while you're on the floor. Tip number 3, research, get familiar with your patient's chart. So typically, and it's again different in every nursing program, but you will be given a patient and you are meant to go and research that patient and go into their admitting diagnosis, their med history, critical items, their labs, their meds, all this kind of stuff. And you usually can do this research. And I'm saying usually because this isn't going to be every nursing program, but once you're given the patient, you're to go and research that patient before you take them on. And remember, that's just for clinicals in the beginning of your clinicals. So here's where you note any valuable information. And then here's where you definitely look up the things that you don't know. So this is your time. It's like a cool little bonus that you get to research all this stuff beforehand, because that doesn't happen when you're actually a nurse on the floor. You get your patient and like you're expected to go from there. So this is a time that you get to research and understand and do a care plan and do all this stuff to really know your patient. So definitely do all of the research you can before you get to the first day of clinicals, or even, as you're going on and getting different patients, try to do all the research you can on this patient. Another critical clinical cheat sheet that you can print off and bring with you on the floor. So this is different lab values that'll be quite important to know for different things. But yeah, here's a little cute sheet that you can print off. Okay, tip number 4, and this is going off to number 3. So now that we've done all of our research, now that we've seen the meds and the diagnosis and we have tip number 4, which is anticipate patient's needs and plan ahead. So now that we know, like I said, we've researched. So here is where you are going to know the tasks that you will be performing, or at least have a really good idea of the tasks that you will be performing. Unexpected stuff is always going to come up, but you'll be able to organize your day from knowing the research of this patient. And then you want to look at specific questions that your instructor will probably ask you about, because your instructor will probably be on the floor watching you, come up to you and do little quizzes for, to see how much of your stuff that you know. So from this, like what I'm saying, understand the diagnosis, understand the conditions, the procedures, the complications, your lab tests, your meds, So looking at that stuff, understand like what are some possible side effects from this medication that my patient is on? What is a procedure that this patient is most likely going to have or have had? And what are the things to look out for that procedure, or complications? What is this diagnosis and what are complications from this diagnosis? These are things you want to constantly be thinking about when you have done your research and you're on the floor. And then for your, like, once you understand the tasks, have a task-oriented mindset, set achievable goals, and keep on schedule. So while you're in clinicals, time management is so key. It is so key. And I didn't know that. I mean, I knew it, but I didn't really understand it until you get into clinicals where you're like, wow, I only have this many hours in my shift and I have to get all of this stuff done. And so when you know you have to get all of this stuff done, what I would do is make a little checklist and be like, okay, I know my day is going to look like this. From this time to this time, I'm going to be doing these different tasks. Then I have a break here, and then I'm going to be doing this, charting, da, 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 da. So once you have that list going in your head and you can just check it off as the day goes on, first of all, it all comes with practice, but the more that you are familiar with your patient and understand the tasks, the more you can organize your day and and properly manage your time. Because at the end of the day, you better be done, So you don't want to be staying hours later doing your charting or having like handing off your patient being completely, it's just you want to make sure that all of your tasks are completed and you are good to go. Remember that being organized plus being prepared equals confidence. So the goal is to be confident on the floor and know what you're doing, understand why you're doing the things that you're doing. And to do that, you need to be extremely organized and you need to be extremely prepared. All right, another critical clinical cheat sheet that you can print off, patient safety and needs. So these are some of the foundations that are going to be very helpful. And also you're most likely to get tested on some of these things. So this is a nice one to print off. They're all nice ones to print off. Another one here is infection prevention and control. With the different precautions, standard precautions, contact precautions, droplet, and airborne. And then we have another one here, therapeutic diets, which is going to be very handy in your clinicals. All right, let's go into tip number 5, utilize the buddy system. So your nursing student friends, the people in your clinicals, you don't realize how important these people will be to you for so many different reasons. First of all, you guys are going to bond like you are in the trenches together, Other people in your life won't understand fully what you're going through. The people in your clinical rotations will know exactly what you're going through. So you're going to have a very special bond with these people, even if you weren't, even if you didn't think you're going to be friends outside of this, like you guys share an experience together, a very intense experience together, and no one in the outside world understands what you guys are all going through together. So there's something very special about that. So it's really important to utilize the people there, if it's just one person or a couple, as emotional and mental support, because no matter what, clinicals are a very intense time. Even if you really enjoy your clinical rotation, even, if it's not that, it's an intense time. So it's important that you guys lean on each other for emotional and mental support, that you have a system to help you debrief at the end of the day, because a lot of this stuff is quite overwhelming. And again, like it's all new to you. So you're going to need to unload some of these experiences and understand from each other, even if a specific experience didn't happen to you, when you debrief with somebody else about their experience, to know if they made a mistake, what they did, what they could have done better, so that you can apply that to your own experience. Or if you can also share your own experience so that your nursing student friends or clinical rotation friends can learn from you. You guys all need to be learning from each other, understanding each other's mistakes and successes. Like this is something that will be ingrained in you as you go on in your rotation. And then a lot of times you're going to be so busy, and everyone's going to be busy, but there's going to be times that you have more, let's say you manage your time better than one of your friends did, and you have a spare hand. Even if like you're like, oh, I don't really want to help this person out, they will help you out at some point too. So like help each other out help each other out whenever possible, because you're never going to know when you're in the weeds and you're going to need help and somebody comes in to rescue you. It's the best feeling ever. And it's really nice to be able to lend a hand when you need to, or when somebody needs you to. Like you guys are a team, so work together as a team. All right, tip 6, ask all the questions. So remember, you are here to learn. A lot of people get like embarrassed to ask questions. They don't want to look dumb, or they don't want to feel like, I should know this already. This is the point. Like, you're in clinicals to learn. So be a sponge, soak up all the information, ask all the questions you have, because this is literally the time to ask all the questions you have to be able to go in and be the best nurse that you can possibly be. No one expects you to know all the answers already. Like, that is just, again, why you are here. Like, you're a nursing student. No one expects you to know all the answers. It's important to seek out the answers so that you can provide safe and quality patient care. That's the point. So please don't be afraid to ask questions. And also, people like when you ask questions, like your preceptor or your clinical instructor or the other nurses on the floor. Like, they like to answer. I mean, I'm generalizing here, but like, it's nice to know when nursing students are interested. It's nice that they can provide you with that information. All right, tip number 7, put in the dirty work. So you want to leave a lasting impression on the staff. Be the first person willing to try something new. This shows a really, this leaves a really good impression. Even if you're scared, even if you don't really 100% understand, if you're the first person willing to try something new, like that leaves a mark. Your clinical instructor will be noting that. And then always offer a helping hand to the nurses on the floor. So here's a little bonus. I hope that the nurses on the floor in your clinical rotations, I hope they're all very, very nice and sweet and want to help you out all the time. But most likely in your nursing student experience, at some clinical rotation, there are going to be some not so nice nurses, or some grumpy nurses, or some nurses that don't love having nursing students on the floor. And that can be uncomfortable and it doesn't feel good. So a tip to help that process go a little more smoothly is to always offer help to all the nurses, especially the ones that don't, love having you around, because then they will be able to trust you. They will see that you're there to help, that you want to learn. And I mean, you're helping them out. So even if it feels like it's, exhausting or draining, or like you don't know what you're doing, always ask if you can help. And this will quickly turn any attitude around. Like, watch it happen. So that's a good tip for you. And then also show up early and get some extra prep time in. It's really nice, when you show up early, because it shows people that you want to be there, that you're ready to learn, that you really want to be organized and prepared to be on the floor. So it shows the nurses on the floor, it shows your clinical instructor that you are ready. Secondly, it helps you kind of calm down. If you show up like, just on time and you don't really get to like process what's happening, it gives you that extra buffer time to like calm down, go into the day very smoothly, like be really organized and prepared when the shift starts, because remember, it's all about getting calm and centered to feel good about the shift ahead. Okay, tip number 8, keep a positive attitude. Avoid complaining about classmates, instructors, or other nurses on the floor. That just provides an environment that like isn't nice to be around. And then it like creates a cycle of that kind of negative attitude around, and it just isn't, there's just no reason to be having that kind of environment. So try to avoid that. Focus on what's going right, because a lot of times too, it's easy to fall into these traps of feeling really negative and complaining. If you're on a clinical rotation that you don't like and it's hard and you hate it, it keeps you in that cycle of negativity, and then it just feels worse every day. So if you can focus on what's going right and turn it into a learning opportunity, and let's say like, okay, I don't love this nursing rotation. I wouldn't want to go into this field of nursing yet. I'm learning a lot. I'm meeting really great people. I'm like expanding, my resiliency. Try to focus on what's going right. And then put your feelings aside and take constructive feedback. So I know it's, not the nicest feeling to get feedback that doesn't that isn't necessarily positive, or it can feel like you can take it personally. But this is the time to remember that like you're trying to learn how to be the best nurse you can be. So you're not going to know how to be the best nurse you can be right away. You're going to have mistakes. You're going to be pointed out to things that you could be doing better. And that's all positive stuff. They want you to be better. You want you to be better. So instead of taking things personally and feeling bad about yourself, take it as a learning opportunity to say, how can I show up better as a nurse? And how can I, you know, how can I show up better for my future self? Because this is all about your future self. And then lastly here, express gratitude. People want to, they like hearing that you're thankful and that you're thankful for their time and teaching them or having them teach you. So just be nice and express gratitude. It's a nice thing to do. Okay, tip 8.5, because there's only 10 tips and I don't like the number 11. So tip 8.5, reflect when you get home. So go back to your notebook from the day. Remember, you have your little notebook with a pen. Go back to your notebook from the day and look up the things you didn't know. I know you're going to be exhausted at the end of the day, but this is all part of the process that you have to look back and reflect on your day, look up the stuff that you didn't know so that you can go into the next day being more prepared and more of an understanding about whatever specific thing that you didn't know. Study your lab results again. It's always just good to look these things up and like get them more and more ingrained in your brain. Do a quick Picmonic quiz while things are still fresh. Remember, you can go into the app. Journal about the day's experience. Remember, you're probably going to have a lot to debrief. Different feelings, different experiences. It's just nice to be able to look back on this stuff, not only for learning, but just as like your personal journey. Like it's a really crazy thing clinicals are. So like to be able to go back and look at how far you've come, that's gonna help you in the future, knowing how much you can do when you feel like things are hard. And then take the NCLEX style questions powered by TrueLearn to further develop critical thinking skills. Remember, those are at your fingertips, so that you can go and really not only like useful for clinicals, but like being able to take the real life scenario that you just had and put them into the NCLEX style questions that we have on TrueLearn. And they'll give you a better understanding once you're studying for the NCLEX, being like, okay, I've seen this in real life, and like now I'm doing the questions. Whereas if you're sometimes just doing the questions, it's easy to separate yourself from it and just kind of look at it as like a theoretical thing when instead of actually picturing yourself as a nurse on the floor. Does that make sense? All right. Here is a quiz from the Therapeutic Diets Picmonic. So this is what one of the instant recall quizzes would look like after you learn about the Picmonic, the specific Picmonic. In this case, it's therapeutic diets. So yeah, that's what that looks like. Tip number 9, remember you're being interviewed. So if you look at your clinicals and think of it this way, every coworker is a potential boss. Every person you are working with, or even like your clinical instructor could be your boss. Like these are people, remember, you might run into these people again. You might have future opportunities with these people. So it's really important to leave a good impression because you never know who is going to be on the next job, who's going to be interviewing you. And so you want to make sure that you leave a really good lasting impression. Tip number 10, treat yourself. Last tip, favorite tip, treat yourself. So clinicals, again, are extremely stressful. It is a really intense time. I really recommend that at the end of every week, even if it's a clinical rotation that you really like and are enjoying, I recommend that at the end of every week, even if it's a small thing, you give yourself a little treat so that you have something to look forward to. And it's almost like a pat on the back for like getting through another week. Self-care is essential. So like, it doesn't have to be something big, but like you could do like, at the end of every like 4 weeks, get a really nice massage or a nice spa day, or at the end of every week, like treat yourself to like a nice movie or time with your friends, like, anything that's important to you, and make it like a nice, like a like a very special moment for yourself. And if you do it that way, if you look at it like a very like something that's very special for yourself, you look forward to it every week, and it helps you get through the week, especially on those rough weeks. So that I can really recommend. Okay. Takeaway from all this, it's normal to be nervous or scared. I think it would be really weird if you weren't nervous or scared. Push through and you will find that you will build courage and confidence every day. When you look back and you see how far you've come and you see what you went through and how nervous you were and you pushed through anyways, it is a very big step in expanding the person you are and understanding how resilient you are. And not a lot of people can do this. So remember that you are doing something really, really great, not just like professionally, but personally too. Okay, so now that we went over some important tips on your clinical journey, I'm going to explain what Picmonic is for anyone who's unfamiliar, because this is a resource that can help you establish a really strong foundation of knowledge that is going to help you feel confident and really blend nicely into your clinical learning. So Picmonic is an audiovisual mnemonic learning platform that leverages learning science theories and the three-step memory process, which is encoding, storage, and retrieval. And that turns hard to remember facts and concepts into really unforgettable pictures and stories. And those are all given through short and effective 2 to 5 minute videos that you'll likely never forget. And in a randomized double-blind controlled study, students who use Picmonic improve their long-term memory retention by 331% and increase test scores by 55%. So how does Picmonic work? Well, the first step in the memory process is encoding. And every Picmonic video uses learning science theories like dual coding theory, picture superiority, von Restorff, and humor effects to help your brain encode the information into a long-term memory. The Picmonic lessons begin with an educational portion of the video, which is where you meet the characters, you learn the facts, and then you break down the information you need to know instead of just relying on memorization, which ultimately is ineffective in long-term memory retention. So here's 2 Picmonic characters to show you what I'm talking about. So warfarin and heparin are 2 very popular anticoagulants that are easily confused, and a lot of nursing students get these confused because they're very similar, but they have very different mechanisms of action. They have very different side effects, things to watch out for, things like this. So they easily get confused, but you're going to be not only tested on them in your exams, but in your clinical setting, you're going to have to know the differences. So what we do in Picmonic is we take warfarin and we turn her into the warfairy, and then we take heparin and turn him into the hippie heron. And this way your brain starts to recognize that they're 2 different things. They are going to be represented by 2 different characters, and then you'll start to recognize these characters throughout the Picmonic library and know that they have different items that represent their different side effects, their different mechanisms of action, so on and so forth. And then it'll be easy to recall this information very quickly when you need it, like on your exams or on the NCLEX. All right, so now going into step 2, which is storage. So this is step 2 in the memory process. So what we have here is an actual Picmonic that you're looking at. So the image is going to be in the main screen. And after you learn the characters, after you learn the information that you need to know, the facts, and the characters that represent those facts, you're going to go into the story portion of the Picmonic. So the story portion will be more of a creative story with crazy characters, sometimes crazy acronyms. It's very creative and funny and wacky, and this is on purpose because even though it might seem a little weird or bizarre, the whole point of that is that you're going to be more likely to remember the weird and bizarre things so that you can recall that information very quickly. Again, it's all memory science. So basically, it's easier for your brain to remember what you need to know if you can associate the facts with phonetic representation or visual characters. And this is known as the Baker-Baker paradox. And what's cool is that, again, these characters are repeated throughout the entire Picmonic library. So all the lessons, you'll see these characters again and again. And this isn't to enforce the storage of information and allow you to build and establish a strong foundation of knowledge. Okay, so the final step in the memory process is to recall these memories, and when needed, even in stressful situation, you'll be able to recall them very quickly. So this is what we call retrieval. And each Picmonic lesson is followed by a quiz that helps you immediately engage in retrieval. And this is a learning science technique proven to support information retention. So answering these questions helps pull the information from your brain and stimulates the memory process and strengthening storage. This makes it easier to retrieve information in the future, like I said, like on exams, during clinicals, or when you're sitting in the NCLEX. So Picmonic has a nursing library that features over 1,200 lessons, over 13,000 need-to-know facts for HESI, ATI, NCLEX. We take you all the way from day one of your nursing student career to the very end. You can even explore the different content that is mapped by topic, by body system, or you can go and see it mapped according to a lot of popular nursing books that we reference. So you'll probably see a lot of these nursing books that you use in your program, and you'll see them mapped exactly to those books. Okay, so just a little more about the NCLEX Smart Bank. The NCLEX Smart Bank consists of over 1,000 questions that are written by top performing nursing professionals and educators who are trained in question writing and familiar with the NCLEX format and content. So like I said earlier, the questions are written to mirror the style of those found on the actual exam and are all categorized according to the NCLEX blueprint. And TrueLearn also provides real-time performance analytics with comparison to the entire nation. So you can actually see how you're performing compared to your peers. And this helps you identify areas of content weakness and strength. And finally, their NCLEX Smart Bank includes several smart tools such as Smart Text, Smart Cards, Smart Search, and more to help you improve the long-term memory, identify your own testing behaviors, narrow your studies to prepare for exams, track progress, and performance. So together, Picmonic and TrueLearn create like a really powerful learning loop that help you speed up your learning and establish a really strong knowledge base through Picmonic, and then you assess and improve your ability to apply the knowledge and think critically with TrueLearn. So combining these two learning tools allows you to identify your content strengths and weaknesses and target them for further studies, which helps you improve your performance, long-term retention of material, and increase your exam outcomes. So it's really a beautiful package altogether. So with that, I want to thank you so much for joining us, taking the time to learn some information. And because of that, we want to give you a 20% off with the code clinicals20. You can see that here. This code is going to expire in 24 hours. If you want a better group discount, if there's a few of you that want a discount, you can email Alexis with the email you see here, or you can scan this QR code. And that is it. So remember, Clinicals20 gives you 20% off. And we really appreciate you taking the time to sit and really, really hope that you enjoy your clinicals and go in with confidence and feel good about it. You can always email us with any questions or comments that you have. Have a great day.